Okay, hello everyone, and thank you for taking the time with us today. A big thank you to the clubs, the swimmers, the coaches, volunteers, officials for your untiring commitment to the sport of swimming. And I'm really talking about prior to March 13th of 2020. We all know that things took a turn from that point on, and we're into it right now. So on behalf of Swim Ontario and the Swimming Canada and the swim community as a whole, a huge thank you for the effort you have all exhibited since March 13th in striving to keep the sport alive. A few reminders before we proceed, and you may have heard them already, but video camera pieces off, microphones off, just so that we can keep the quality of the conversation at the highest we can. We'll stay within the lines of the Return to Swimming framework, and we will have a Q&A to address the advanced submitted questions, as well as you can access the chat feature by typing in your question as the discussion carries on. Questions not within those lanes are captured in your invitation earlier today, and all others will be addressed at different times in a different forum. So thanks very much for following those. The collective, that's us, that's we, the swimming organization, sport, government partners across the country have worked unrelenting together during the uncertain time, and will continue moving forward for a safe and successful return. We all want to get back to swimming and to some semblance of normal, including back to swimming, back to training, back to what we all love. And we have to do it safely. The semblance of normal are guided by personal hygiene, stay at home if you're sick, environmental hygiene, safe and social distancing, interactions, and physical modifications. Reopening must be planned around assessing the risk and protecting our participants from being exposed or infected with the virus. We need to understand our provincial health authorities' directives, and which are process to open and restart safely, measures to keep people safe to avoid further outbreaks, a plan in the event that there is a case or an outbreak should occur. This is going to mean a very structured and detailed approach to regarding how we interact and how we use our facilities. Hygiene restrictions on the amount of people in the facility, understanding facility rules as some examples. This will become clearer in the next few weeks. It will not be easy, but it is necessary. We abide by our Canadian government, provincial jurisdiction levels, their measures and recommendations. And as if you just heard that the Premier has extended the emergency conditions to June 30th. We will work with these layers of direction every step of the way. We continually seek to understand, working collaboratively in the best manner to be understood. We are pleased to have John Atkinson, High Performance Director of Swimming Canada, and Dr. Allan Wrigley, Director of Integrated Sport Teams of Swimming Canada, with us today for an overview of the Swimming Canada framework to swimming, and address some of the questions that you have posed earlier and as we go through this. So thank you very much. Thank you, John and Allan, for being with us today and your time. And I hand it over to you, John.
Okay, so thank you, Dean, for that introduction. And also thank you to Dean and Swim Ontario for the opportunity to join your call today. It's really appreciated because, you know, in discussions with Allan and everybody else, we're at a really, really important junction for our sport. It is very, very important that we as a sport are coordinated, that we're responsible so that we can show how a safe return to training in this first instance can occur. And I would say, before I get going into highlighting some of the things about the Return to Swimming resource document and framework, I know Dean mentioned the 13th of March, and on the 13th of March, I traveled back from Florida, where we had a team on a training camp. We had two teams who didn't travel, ready to do their taper camp into the trials. And I sent an email that night, and the email went on about a lot of things, and at the bottom it said patience and calm. I didn't realize that 81 days in, I would still be preaching the same message of patience and calm. And it's certainly been a very unprecedented time in the world, and in the world of sport, which is the area that we are all very closely familiar and associated with. I think obviously things moved to a different level when the Canadian Olympic Committee took the decision to say that if the games weren't cancelled, the Canadian team would not be attending in July of 2020. And at that point, plans that had been put into place over the last 5 or 6 years suddenly had to be pulled apart. Events were postponed, cancelled, and we all understand how that made a lot of people feel, and managing the emotions of all the carded athletes from both the Olympic and Paralympic programs across Canada, and the impact that that had with them. And where we then kind of went into this period of postponement and withdrawal of policies was after meetings with the athletes and some of our carded coaches, the message was, give us something to plan for. Show us where this can actually go into the future. So we started to rebuild where our plans were within high performance initially and for the sport. And I think where we're at now, as I just kind of alluded to, is this very, very important phase where Canada and each province are looking at how they open back up in business. How do they get back to doing things in the new normal way? And I choose those words very carefully because it's not going to go back to where things were on the 10th of March. It will take a concerted effort to be coordinated, to show that a return can be responsible, that it can be safe for the health and well-being of everybody that is involved in the sport. So the document that was published last Friday, I'm going to talk to parts of that I think are really important to set some context before Allan will talk about the health issues, before we talk about what a return can look like. The document is meant to provide information and guidance to show best practices on the current information. And that's a really important word, the current information, because as we know, things are progressing and change very quickly. What was known 3 days ago changes on today, can change again tomorrow. So it's important to say that our national return to sport, return to swimming document has to consider how this looks nationally, but also very much understanding how within each province there will be a provincial government, there will be a provincial health authority who take precedence over everything that we talk about today. Our return has to fit within where those provincial health mandates and government regulations and restrictions sit. So again, acknowledgement of working with the provinces so that they can look to how their plans will complement the mandates that are in place, and then how clubs, universities, performance centres all have to come up with their own specific ways that they can return given the information and the current advice that's available. So when we put this document together, we were quite fortunate. I was asked to sit on the National Return to Sport task force. And that would include people from On the Podium, Canadian Olympic Committee, Canadian Paralympic Committee, Sport Canada, Canadian Centre for Ethics in Sport, and the list goes on. When that group was formed, it put us into a really good position because from within Swimming Canada, when we struck our working group, we could feed information to the National Task Force, and likewise information from the National Task Force could come back into the Swimming Canada document and way of thinking. I think that it's really important to note that there was a wide diversity of people that contributed into the development of this framework. From a medical perspective, our Chief Medical Officer, Dr. Steve Keeler, was very much involved, along with Allan Wrigley and Dr. Stephen Norris from Alberta, plus provincial leads, CSCTA, events people, Paralympic perspective, open water perspective, and a pool perspective, all feeding into that working group. I also want to acknowledge that there was coaching subcommittees with a spread of coaches from small programs, big programs, universities that were involved in some suggestions that we took forwards. When we've got to this document being produced, we may have had 15 drafts of this document, but it's version 1. We will be under continual review of where things sit and how things go, because things are moving so quickly in where we are at with our version of this document. And we are eager to see the return of the sport, but are working with provincial governments, provincial health authorities, and federally about how we can make this a first and foremost a safe, responsible return to swimming. So when we have put this document together, it comes from a perspective that there will be steps in this. Nobody's back in swimming now. We want to see that happen. And when we get to it, we will then go to step 1 of what this return can look like. So before I get into the swimming framework perspective, I'm going to hand over to Dr. Allan Wrigley. I'm going to ask Allan to give his overview of the overriding health, medical, and safety information that has been considered and should be considered as we embark on this process to return to our sport. So, Allan, over to you for this moment.
Thanks, John. I think probably the best place to start at is again getting back to how John has already described the framework. Is the medical recommendations are guidelines that reflect the general consensus across the country from public health officials in terms of restrictions or recommendations on how to behave and act in general society right now to control the contracting and spreading of this virus. It's very different across the country, and every province is a little bit different. Even as something as simple as the federal government saying there is no restriction for interprovincial travel. However, most of the maritime provinces, Newfoundland and Labrador and Manitoba, do restrict interprovincial travel and have a required 14-day isolation period. So the interesting thing is aside from those kinds of policies, everything throughout these medical recommendations can be kind of viewed the same way, where we're looking at it from it's like kind of a national average, so to speak, and not necessarily specific to a given region. And a given region or province or municipality may have different public health restrictions and guidelines in place. And so first and foremost, what people need to understand is that provincial, municipal public health information and guidelines have to be respected and will supersede any information that we provide, because that's the mandate that we have to work under. And so part of the medical recommendations and the overarching mandate that we were given as a national sport body is, how do you get back to competitive sport in a safe and controlled way? And the way that was kind of put to us was, how can you mitigate risk as much as possible to present the lowest risk possible situation in order to get facilities to get back open? And so a lot of the recommendations as we go through there is all about that. It's about mitigating and managing risk. Can you make a decision or a choice to say, yes, do this, don't do that? And can you change the overall assumption of risk that somebody has to take? And when we talk about someone having to take, we're not talking about necessarily the swimmers or the parents or the coaches or the staff that work around this. the first people you have to convince about this are the public health authorities, because they're really the only ones that are able to make a decision to say to a facility or to a business, you can open. And we have to get it past the line with them first, and then it'll be up to the facility operators. It would be the next people that make a decision that say, okay, we're allowed to say have 50 people under our roof. Okay, we don't see that being manageable. We're only going to allow 25 people in, or whatever they decide. They don't have to go to whatever the maximum the public health officials say they can do. They'll make some decisions internally. And so the cascading effect is that the framework has to be able to fit within current recommendations around group and gathering sizes, and has to respect all the public health restrictions around physical distancing. And all of that is going to change, and it's going to change within a very specific municipality or within a province as you move across the country at different times at different rates. And even how those get interpreted become a little bit different. I believe that, as Dean has said, the emergency order in Ontario has been extended till June 30th, and at this point, you can't have gatherings of more than 5 people. So if you want to look at a swimming example, so a coach and 4 athletes in the water. However, if they apply the gathering size to a building, well, then means then you have to take away the lifeguard or the attendant that's at the front desk looking at you. And so the difficulty that we face right now is presenting a way to the public health authorities to say that these facilities should be provided an exemption. And which is why other businesses are allowed to open. A grocery store can have more than that gathering size inside of it, is because they've been given a designation of an essential service. And so the requirements around physical distancing are still in place, but say the amount of people under a roof, they have an exception to that. And at this point, other than in New Brunswick, where they've announced that they're supposed to open the pools last week, but that's got pushed back due to an influx of COVID-19 cases. And it sounds like in Montreal, they will be, or in Quebec, opening up outdoor pools, but it's still not clear how that's going to work, because they're going to open them up, but they still have to follow the same group and gathering size restrictions and physical distancing restrictions. So how that works in practice is still largely unknown, despite the fact that some of these places may be opening in the coming days. So again, it's just to highlight that the state of flux that everything is in. And what we've have outlined right now is sort of the guidelines that fit the restrictions and the requirements that are generally in place across the country. Those are going to change. They're going to change at the pace that public health officials change them. And we will update and change and provide recommendations accordingly. So one of the hardest things as trying to get facilities to open for pool training is going to be the physical distancing requirement. Actually, no, the first step is going to be getting them to relax the group and gathering size restrictions, because that right there is going to make it extremely difficult, if not impossible, for these facility operators to even choose to open. If they can only open for such a limited number of people, they may say it's just not worth the cost. So first and foremost, we need to be able to get that exceptional status so that we can get those group and gathering size restrictions changed. The other piece that we need to be able to do then is be able to present and reflect a physical distancing capacity. And right now, the prevailing opinion from public health authorities that we've been dealing with has been, it's not just the square footage of a place. It's not just how much volume of space do you have to allow a certain number of people in, because they look at it, the coincidental incidence of as group sizes increase, the likelihood of people encroaching within that physical distance increases. And so they have a very different way of, a different standard that they end up applying to some of the processes that we present. And the amount of information we get back is not super detailed in terms of why, other than we're just being told. In particular in Ontario, high performance sports can go back and open up their training facilities. Pro sports can end up doing that unless you're in a pool. So their exception that they've put in for sport in the province still has the caveat being, but you can't open up a pool. And to be quite honest, we don't know why, because the pool is the safest medium that anybody can go in and train in. The virus is not sustainable within a chlorinated medium like water. But as much information as we provided to the public health, the Ministry of Public Health in Ontario, for whatever reason, they keep coming back and creating that caveat and sort of clause. And so again, we just continue to pursue and push and show how we can do this in a safe and controlled way so that they can allow these facilities and places to open so that we can get back up and running. The first step is get the doors open and demonstrate a way to be able to do it. And the second step is going to be, okay, now let's be a little more flexibility in the rules and the requirements so that we can operate more in a financially viable situation. But at this point, there just isn't an option to operate. And so again, these guidelines are trying to address and provide a framework about the safest, most controlled way that we can do this so that we can get the approval to open up the facilities. And again, like, although this is obviously with Swim Ontario and Ontario in mind right now, this is no different than the conversations that we're having in all the provinces that we end up dealing with. It's the same sort of pushback that we've been getting, or the lack of forward progress with these health authorities. Well, maybe not necessarily specific to the health guidelines we've put in place here, but I do think it's important at this point to point out that a massive holdup in this process is, and this has been consistent across the country, in order to open up a facility, it needs to be tested. You have to have a public health inspector come in, test the pool, test your operating procedures, test how the facility wants to operate in terms of presenting their model of physical distancing. So they need to come in and approve that operation. The same people that do that testing and approval are the same people that do the COVID-19 testing. And so their capacity to actually go and physically show up at a facility and say, yes, this is perfectly fine, is so low right now, because all their time is taken towards meeting provincial requirements and mandates around the volume of testing that should be happening on a daily basis. And again, I finished talking with some people from Swim Alberta earlier, and they're facing the same problem. They have a good plan in place, they have facilities ready to go, and they just can't get a public health official to show up. And their reasoning being that they just don't have the time because of the overwhelming demand on the actual testing and tracking of things right now. And so something that we're just facing right now is, even with the best sort of controlled framework in place, it's still proving extremely difficult in order to be able to get access to the time for the people that can come in and actually sign off and say that this is a safe thing to do and allow that facility to open. So hopefully, I think, Dean, that should provide at least a general oversight as to kind of why we've come up with this framework, or the medical recommendations and how they apply. And then it's up to each province to look at the specific public health requirements within that location. And so again, like in Ontario, it being a group size of 5, gatherings of 5 is restricted, where say in BC, it's very bizarre in BC. They have 2 rules. A gathering can't be more than 50, but a group can't be more than 5. Or sorry, more than 6. So you can have 50 people at a wedding, but no more than 6 people at a table. Like, it's how it actually gets applied is very different by each regional health authority. And they have 2 sets of rules. But anyways, it's up to each sort of provincial body to come up with how do you fit this framework into your specific requirements that your public health authority has put in place.
Thanks, Allan. John, do you want to, and I'll just, before you start, John, this is the way I understand it, especially when it comes down to the capacity issue with the health authorities regarding opening pools. It is just, there's so many pools. We got to remember, there's not just a few pools closed, they're all closed. And I think it is that major reason around that. But at the same time, we need to just keep endeavoring to influence and educate around good plans. But that's a big question that I think that's close to the answer. It's a capacity issue at this point in time.
Yeah,
So,
Dean,
John?
I'd probably add to that, just so everybody's aware that with Dean and ourselves, we're working very, very diligently with Canadian Sports Institute Ontario. And Debbie Lowe, who's the president of Canadian Sports Institute Ontario, is co-chair of a working group that reports to the Minister for Sport in Ontario. And we're really working hard with Debbie, showing all the safety issues, the health considerations, everything that we've gone through in the plan, so that Debbie, as co-chair of this committee, can talk to the Minister for Sport. She's talked to the caucus of the government, that they're talking with the Minister for Sport even this morning. Athletes from Swimming Canada have been involved in showing how important this is and how responsible and safe a return can be for the sport. And I think Debbie's doing a fantastic job in that, but it's not straightforward. It's not simple. It's complex. But we have good people that are pushing that envelope so that not only high performance sport returns, which is where some of this started with the National Task Force. But when you look through the document, and there will have to be some priority grouping. And within the Swimming Canada framework, there are 5 groups that are considered that are in this priority order. But the 5th group is based on the specific program of club and facility. It won't preclude anybody from being able to return at this step 1. It's covering a priority order for a step-by-step approach to this. And the group that you put together in this step 1, and this is an important line that comes after those priority groupings, should be limited to mature athletes capable of independently adhering to strict physical distancing guidelines. And that's a really key point for everybody to consider, that when you're putting these plans together, at the moment, it is 1 swimmer per lane swimming on the black line, that we know there are a minimum of 2 meters apart from each other, so can adhere to the physical distancing guidelines. What we have been told from the facilities that we're looking at, there will be specific parking areas. How you get from those specific parking areas through the door. At the door, you may be asked the questions that we have. Have you any of the symptoms? Have you traveled out of the country in the last 2 weeks? All these questions that you will get at that door to get in. There may even be temperature checks that are administered by the facility when we come in. And I'll let Allan answer the issue of temperature checks in a moment. So just keep that one, Allan, where we're at with that issue. There will be one-way flows to the pool deck. There won't be land work on the pool deck because we're trying to, again, mitigate the risk, reduce the number of surfaces and contact points that the virus can spread. Get to the end of the pool, be ready, change when you arrive, swim, and then depart the building via another one-way flow. We recognize that that's extremely difficult to operate within. We do get that. And the thing that we have to say is it's no different than a lot of businesses are having to contend with. Is it going to be profitable for a business to open under these conditions? And some businesses are taking the approach, let's get the business running and operating again. We might have to go for 2 or 3 weeks before we can get to the next step of what that business has to operate under to be a viable business. Same as this for ourselves, the way that we're looking at this and the way that we're talking to public health departments across all the provinces, this is a way back. Is it where we want it to be? No. But small, stepped, responsible, safe way back that can be developed in time as the provincial health mandates change and group sizes can be increased. Gatherings can be increased because we've shown that we can come back in and do it in a safe, responsible way. And I think that all of that is really worthy of everybody to consider, whether that's now, whether that's in July, whether that's in August. There will still need to be, at whatever the moment in time is, a safe, responsible plan to return. Where are we looking from Swimming Canada's perspective? And what we've put together, and we will follow with our high performance centres, is a model that will be stricter than what public health are expecting from us, because we want to show a controlled, responsible return with a small group. We will put together an assessment group. Part of that assessment group would be our high performance centre coaches, Allan as our IST director, Dr. Keeler as our national team physician, our senior coach, and we will sit down and review the risk assessment mitigation tool that the National Task Force put out for sports to consider. That will look at every area. How can we bring down the risk to a level that shows that it is low? Things like not using whiteboards, no land work on pool deck. Reduce that risk so that we can be considered as a sport to return ahead of when the general public come back in. And it's quite simple. If we don't show how we continually reduce that risk to an acceptable low level, we won't be back in ahead of the general public, because we will be seen to be as big a risk as what it is having groups of people come back in when the general public can come back. So that's the whole kind of philosophy. We do the risk mitigation tool. Then as a centre, and we put a plan together. Then we run that plan virtually past the coaches and the staff and the athletes, that we work with the facility manager in explaining how our plan will work. And then when we get back through the door, each day in week 1, we will do a catch-up call. Week 2, we might do it twice a week. Week 3, we might do that once a week, so that we are showing this progression as to how we would do that with a high performance centre. Now, obviously, understanding how clubs operate, part of the document and one of the appendices shows how that might work from a club perspective. I'll put my video back on. Sorry, Nicole, I just realized I didn't put my video back on. We'll look at how that can work from a club perspective. So that might be that the club, with the president, a medical professional, if they have a doctor or a public health professional, the facility manager will start to put their plans together that work and fit within the provincial health requirements and expectations. Then there would have to be a situation where virtually again, the parents, the athletes are taken through what that plan looks like, what the expectations are of that plan that's in place. Then there could be a return. And the things that we've put in the document about key considerations come from that risk assessment tool. So specific measures to limit the transmission. That's where you're reducing the risk. That's where you're giving the athletes the sessions before they arrive at the pool, so that we're not on the contact surface of a whiteboard, everybody gathered around it touching a whiteboard. Staff knowledge. Are your coaches, the staff, the parents aware of the plans that we're putting into place or you're putting into place as clubs? What's the public health mandates and awareness that you have to have? What's your emergency preparedness plan? And I think Allan mentioned, if not on this call, certainly on some of the calls that we've done, what to do if an athlete presents with the symptoms of COVID-19, and that they then contact their primary care provider to arrange for them to go and discuss and have the test if necessary. So there are all these things that are kind of in here that clubs do need to consider at this step 1. And I think it's become very clear to all of us, as this moves very quickly, this will have to adapt in time with provincial mandates that come out, and they're different from province to province. And that's why we are working very closely with Dean, with Swim Ontario, about how this looks and what we can do to assist for all levels of swimming to return safely, but in a step-by-step approach. Allan, you might just mention the temperature issue that I said a couple of minutes ago.
Yeah, I guess I definitely can address that. And I think a lot of facilities, as we've been informed, will likely be doing some sort of temperature screening. It's not something that we recommend or advising, because it is just a symptom of the virus, which is no different than if you're having shortness of breath, sore throat, persistent cough. And so I think one of the things that this is worrisome from a public health perspective, which is why it's very difficult to reopen facilities, is just the nature of the virus itself is very, very tricky. And so the incubation time after you contract it could be anywhere between 1 to 14 days. Most people do not present with any sort of symptoms until 3 to 6 days. And I think the median is around 5 days. However, you are usually most contagious in that 2 to 3 day window. And so a lot of diseases, when you end up getting them, or viruses, it's when symptoms show up, that's when you become infectious. That's the incidence of viral shedding. And that's when the greatest opportunity to spread this to somebody else. The super unfortunate thing about COVID-19, which is why it slowed down the opening of everything across the world, is our current understanding of this virus has been it's sneakier than that. It typically becomes more infectious and more contagious before you even know you have it. Even if you do develop symptoms, a lot of people don't, they're asymptomatic, but even if you do, that's not the onset of a real concern around infection. And so doing symptom management is absolutely critical. You need to be able to track and monitor the symptoms, but in our opinion, going to the extent of doing temperature measurement at home before you showed up at work that day is the amount of extra cost or process you have to go through versus the benefit of, well, chances are you've been going to work for the past couple of days with the virus anyways. It's just, that's the nature of where we're at with this virus. And again, it's not to deride hospitals or airports or different places that are doing temperature scanning. That's how they're doing symptom checking. We're going to advise doing symptom checking just through daily physical health monitoring of yourself. It's much easier to walk by somebody at an airport, at a business, and them scan you than ask you a series of 10 questions around various symptoms you may or may not have. But we're in a situation where we can do that kind of symptom tracking and not necessarily have to rely on temperature measurement, because it's no more reliable than any other symptom that you can look for.
And just to add to the points that Allan mentioned there, we are likely to have a number of facilities that require that for entrance. That doesn't mean to say that we're going to argue against that point. We will do the temperature checks, because if somebody does have a temperature, they shouldn't be training anyway if they're turning up with any of those symptoms that we're asking them to self-monitor and report on at home before going to the session and before getting into the water. Okay, Dean, I've got through that there.
You've gone that, and Allan, thank you very much. You know, it was just an overview of the full documentation. We realize people hopefully have had a chance to read it and digest it since Friday. I think it takes several reads to get a handle on things. It all depends on what level you're at in your own community and understanding the process. I think the next phase, and we're just a bit concerned, we're going to show the advanced questions. We're at a Q&A piece now, and to do it in a managed, because we have a large group, we have 140. So here we go. Thank you, Nicole. Fantastic. And I can put myself on video so I can. Well, it doesn't really matter. It's not huge. Anyways, let's go with the first question, and then we'll pose it to either Allan or John. You guys can arm wrestle. So how often will you do a reevaluation of getting back to protocols?
I think I kind of mentioned that already. I think that we are under this kind of situation where things move very, very quickly with where provincial health authorities are at. And already there may be differences across Canada, and what trumps everything that we have in the framework and the recommendations and what will be in Dean's plans and Dean's recommendations is where public health are at. So it's going to be under continual review, but it's likely the document won't be updated for at least 3 more weeks. We are also developing a frequently asked questions section that will sit with the document. Allan, you want to add anything there?
Yeah, I think it's, again, maybe it's repeating the same thing you said, or maybe just saying it slightly differently. But It's going to be continuously reviewed. Now, the specific updates, a lot of it will be driven through the PSO. And because of the fact that a lot of the public health recommendations as they change are going to change specific to that province. And so as an example, the framework asks a question around, have you traveled out of the country? Well, one of the very first questions we had from Manitoba was, well, our public health officers, the public health ministry in the province has, we have a provincial regulation that if you come into Manitoba from out of province, you have to self-isolate for 14 days. But the federal government doesn't have that requirement. So specific to Manitoba, absolutely you need to reflect whatever your public health authority is. And that question, and if you're putting that to your members, needs to say, have you come from outside the province? Because it's very specific to that region. So those things can be updated as the governments, provincial governments, put out more information, which seem to be in 2 to 3 weeks cycles, depending on the province you're in. And in most provinces seems to be happening on a Friday. The other level of how often do these things get reviewed, once we have a facility that is open, and I can only speak to the programs that I am intimately involved with, is we will actually look at the process and protocols every single day. Because when a facility first opens and they say, this is how we're going to operate, there's going to be some growing pains. And they're going to realize what works and what doesn't work for them. And there's going to be some dialogue between the user groups saying what works and doesn't work for them. And so we need to be able to evaluate how these guidelines get implemented on a practical level on a daily basis when the program first opens up. And likely going to be like that for the first week. And then usually by the second week, we anticipate getting into a much better routine. So maybe only have to meet and have this sort of review twice that week. And by the third week, hopefully we're only at a point of doing it every week. But again, it's highly, highly dependent on the rate that public health guidelines change. And it's going to be very region specific.
Okay, great. Next question. How is Swimming Canada communicating to the various municipalities, if at all, lobbying for getting back to the water? I think these are, it's a good question how we're doing it. I mean, the program has just been somewhat launched, put it into the frame of the swimming community. What are we doing? What can we do?
I'll start and I'll jump in front of John on this one and he can fill in the more specific details. But again, I can actually speak a little bit more specifically about Ontario because of the great leadership of, as John has said, from Debbie Lowe in terms of really pursuing this with the Minister of Sport and the Minister of Public Health in the province. Is for well over a month now, we've been being asked by them to provide the documentation and sort of the proof or the evidence to say that swimming is safe. So we've gone and gotten information from the Centers of Disease Control, World Health Organization. We've been feeding information to these officials to say that this virus cannot last in water. Like opening up a gym is so dangerous right now. Having somebody jump in a pool and swim is not. But they're saying you can open a gym, but not open a pool. It doesn't make sense to us. And this is despite the fact that I think it's been 5 weeks now of, again, steadily streaming in the sort of evidence and advice from international experts, not even just domestic experts. And so there's been a lot, but our sphere of influence is going to be more at the provincial level, not necessarily the municipal or regional level, just because we don't have the contacts and just the breadth of what that means. I think in the GTA, Debbie said that there's 13 different health authorities that span the GTA. So each one may have slightly different rules and different people making decisions. So we have to, at some level, leave that with the local people to pursue further.
Okay. And coming back in on Allan's point there, when we first started that process of discussion, it was about, is the water safe? And then we kind of proved the water was safe. Then it was, well, the issue is of walking on pool deck and getting into the water. So then you have to show this issue of mitigating the risk. And how you mitigate the risk around the pool deck is how we put the plan together to work in practice, so that we can say, Yeah, we acknowledge that, but by doing X, Y, Z, the risk is mitigated so that then the return around the pool deck can be safe. Then it turns into, how do you access the building? How do you walk around one way, leave another way? You reduce the contact points of people walking past each other. So it's happening at that level. We obviously have a more limited ability to work with every municipality. And that's where the key point comes into play here. There is a Swimming Canada Return to Swimming National Framework of Recommendations. That feeds into what Swim Ontario are doing. That feeds into the club plans. So that when a municipality comes to the club and says, where are you with your plan? That you can then say that we are following what's been recommended through Swim Ontario, through Swimming Canada, through the National Sport Task Force of mitigating these risks to show that we can have a safe return to the water.
Thanks, John. Thanks, Alan. Next question. Yeah, here. Would it be supported to have outdoor dryland activities that follow the physical distancing public gatherings as a partial replacement to swim practice as clubs follow the outlined STEP program? I mean, these are all the creative, innovative ways to look.
Absolutely. So one of the big stumbling blocks that we've had with facility operators that we've dealt with is this idea, again, it's unfortunately, they're not just looking at it from a square footage perspective and saying how much space do we need in order to ensure physical distancing. They're also looking at the flow and movement of people and the increased incidence of incidental sort of encroaching on that physical distance. And at this point across the country, regardless of what province you're in, that is the one sort of consistent requirement. And it's an actual, I believe, even in the city of Toronto, it's a ticketable offense now if you don't maintain that physical distancing. And whether or not they're enforcing it or not, it doesn't necessarily matter. It's the fact that that rule is in place. So with facility operators and having a lot of concerns around that, absolutely, we would be looking at, and what we're doing with, say, the center programs is all the dry land would be done outside of that facility, whether it's done outside in a grassy area, in a park, again, following what the current restrictions are. And again, in Ontario, that would be a gathering of 5. However, that is absolutely a way to take a burden and concern off of a facility and take a little bit less of a burden and onus on them around sanitizing and cleaning and trying to get sort of all the appropriate public health sign off on it by taking it away from the pool deck and doing it at another location, in particular outdoor locations, which most provinces have gone to having looser requirements if you're outside in a field than you do if you're actually in a facility. Then it becomes way more manageable to manage appropriate group sizes and do a lot more programming. And one of the things we've been talking a lot with Steve Norris in Alberta is, his ideas around this reimagining what programming is. And, if you had normally 10 hours of training in a week, what does that 10 hours look like now? And before, 10 hours of training may have been 10 hours of pool-based training. And I'm sure I'm stealing all of John's lines here, which is awesome. Maybe that 10 hours of training, it now constitutes, 3 hours of pool based off restrictions around a facility. Maybe it's 3 hours of doing some dry land and organized activities out in this field. Maybe it's 3 hours of doing some online Zoom time meetings. And maybe you have like an education session around, managing yourself, eating habits, or whatever you want to do. And you put together 10 hours of content for a week. It's just a different 10 hours than what you're necessarily used to. But the facility restrictions and public health restrictions around facilities are structured in such a way right now and are, call it oppressive. They're so oppressive that there has to be different ideas like what you've described here, Dave, is where, what's another way I can do this and not rely on the facility, because I may be able to have a larger group size. So I believe in Alberta, their max gathering sizes are 15 under a roof, but 50 if it's done outside. So definitely there's a way more of a greater opportunity to be able to provide structured programming and training if it's not done within a facility.
I'd just jump in there and say, what we've kind of got into there is looking at the new way forwards and how we have to approach swimming clubs and what swimming clubs offer. You know, where we're at now is not suddenly miraculously overnight going to switch back to where we were on the 12th of March. What we have to get to is this controlled step-by-step small group return, and basically get your foot in the door, show people what can work. Then when you show it can work, is rethink how clubs can operate for the future. And as Allan said, I said it earlier on a call, rather than it being 6 2-hour sessions a week, it might be 6 30-minute sessions, so that you can have a group come through every 30 minutes eventually. Then it might be that you're doing the Zoom calls, that you do education practices, so that as a club, if your group is getting 12 hours a week now, and that's all in the water, they're still getting 12 hours a week, but it might be broken up completely differently. And those 6 2-hour swims might be 6 30-minute swims. And this is not a way of saying, you know, is that what we do in an ideal world? No, it's not what we do. But if we're going to move forward as a sport, there's some of the strategies that will need to be thought through and put into place. And if I bring it right down to the dollars for clubs and the club's future, that they can still say to a parent, you're still getting 11 or 12 hours a week. Instead of it looking like A, it now looks like B. But we can now operate and function that we're still providing 12 hours a week to the athletes that are in that group or that squad.
Great, thanks. And just one little mention here is that all our activities need to be from the approved insurance platform. So that's always another wrinkle. And just on that, just understand, everybody on the call, that we are going to have to be more compliant with way more rigid documentation than ever before. And we're getting a handle on some of that, but there's things that are still to come. So be quite patient to that. And it is coming. There's no ways around it. Okay, next question. Okay. When asking questions of our athletes feeling well, shouldn't we also be asking if everyone in their household is well?
Yeah, so this is a fantastic question, and this is a bit of a rabbit hole that we ran down some time ago. If you follow the stated medical guidelines that are in this document and adhere to the restrictions that are in place through public health authorities, the odds of you contracting or spreading this virus through strictly following these things is incredibly low. Somebody, when you return back into a facility and you bring an athlete, some athletes and a coach back in, and a program's allowed to operate, the chances that someone's going to get sick in that group and potentially spread the virus in that group are almost guaranteed to come from outside of what you're physically doing. It's going to come from what these people are doing on the evenings and weekends. Again, I cite New Brunswick as an example where, you know, they had no new cases in 10 days. They had one active case that was recovering. The province was ready to reopen. And a doctor took a holiday on a weekend, went to Quebec, came back, and had contact with 150 people. There's now a cluster of 13 new cases, and they're continuing to do the contact tracing. It's caused the hospital shut down. It's caused all the facilities to no longer open as planned. And because of what somebody did by not adhering to the actual guidelines that the province had put in place, not following the proper self-quarantine, and not following the appropriate guidelines around don't do unnecessary travel. And so that's the danger that we get in, is that chances are it's going to come from somewhere else. The problem with all of this is that asking just the athletes how they're feeling that day, you're right, is not enough. But asking their parents and the people in their household how they're feeling is not enough either. Because the questions that need to go, in the past, since I last saw you, how many people have you been in close contact with? Did you pass a neighbor on the street? Have you been out in the backyard playing with neighbors, gone on a bike ride with some friends? How are they feeling? Do they have any symptoms of COVID-19? And so I think one of the things that we're stressing a lot is that as we get back and facilities start to open, we're strongly advising, if you are bringing a group of athletes back into a program to start up training again in a facility, is really pushing hard for them to crack down on their social behaviors outside of the training. If they've been hanging out with neighborhood kids and they've been hanging out with other things, evening barbecues, neighborhood barbecues, and doing stuff on the weekend, going to the beach, that kind of stuff needs to stop when the program starts again, because that's where the virus is going to, so much more likely that's where it's going to come from. However, getting back to the specific question is we've left it at what we can control, which is how the program operates. So that's asking the athletes and the staff, and then advising them against all the other social behaviors. I think one of the things that we determined with our sort of medical review committee was, the cascading. At what point do you stop asking the question? And so in our minds, we're going to leave it at the athlete and the staff, but absolutely what is happening in their household, what have their household, each household member done over the evening and weekend? And like all of those things are huge factors in terms of maintaining the integrity and health of that returning group. And this is what has, in most provinces, public health officials scared, it's what happens when something else happens. So I'll steal maybe 2 more minutes here, Dean, of ranting on this, because it drives me nuts with the people I end up having to deal with and try to convince that this is a safe thing to do. But the examples that keep coming back to us is, say, in Quebec, they're taking a much looser stance on things, and the public health officials are okay with there being a human cost to opening things up. They open up their schools, which most provinces would say they opened them up far too early. 6 days later, they had 41 cases, and that's not even with 100% reporting across their school districts. 41 new cases involving children and teachers. And their public health minister came out and said, yeah, we totally expected that was going to happen. So? And so, like, unless a public health official decides to take that stance and the community is okay with it, they're just not going to open things. And the other piece that has come up along these lines is I live on an island. I live on Vancouver Island. There hasn't been a new case of COVID-19 on the island since May 7th, I believe. We still have to follow and live under the same very, very strict social distancing and gathering sizes that the lower mainland does, where all the COVID-19 actually exists, because the public health authority have deemed we're not making different strokes for different folks. Everyone needs to follow these rules. And sometimes it's difficult and it's hard, but that's kind of the line that they've decided to draw in the sand and say, this is as much risk as we're willing to take. And we're just saying, we're not creating different sets of rules. These are what the rules are. So maybe some of that maybe does not totally address this question, but I think that that's a decision we've made. And if some Ontario or you as a club decide, you know what, I think it is important to find out what's happening within their household, by all means, go ahead and ask that question. There's nothing wrong with that. The more questions you ask, the better information you have. It just complicates the tracking and monitoring process. But absolutely, the more you know, the more informed decision you can make about how much risk you're willing to assume as an operation.
Okay, perfect. Just before we go on to the next posted question, there is a bit of the chat questions around competition. The number of just around, but we're not there yet. There is so many steps that we have to take place before we can be concerned about competitions, especially as we knew them prior to March 13th, as to what they might become in the next and near future. Comment, just maybe to put this to rest. It's way too soon, in my words.
Dean, I would completely support you there. I mean, if you consider that we're about 12 weeks out of the water on Friday, no structured club, university, high performance center training has been taking place in pools for 12 weeks. We've never been in this situation before. And the first priority in all of it is let's get back and train. Let's get back into the water first. Let's get a pool open that can show how responsible this is, and that we can get other pools open and more clubs coming back. And then when we get the clubs coming back, think of how those clubs are going to operate. I go back to that idea of, instead of 6 2-hour sessions, it's 6 30-minute sessions, and you can rotate your groups through eventually. I mean, we're not there yet. So competition is part of this that will fall under eventually, you know, it could be competitions behind closed doors. It could be drop the swimmers in. It could be only certain age groups are allowed to come back, so that you're reducing the numbers in the building. But, you know, we've not, I can say we've not really considered it, because the primary focus is about, let's get people back into the pool safely and training before we start to go down the rabbit hole of competition.
Exactly. Let's get faces in the water. This is regarding open water scenario and just around taking groups for a 3-week period, working with the distancing. We will have an open water document probably ready around the training piece later this week. That's been one that's been tossed around a bit. Just based on this comment.
So I think that there's two things. One, I can't address or talk to, and that's the insurance piece. That the club, if you're running structured workouts, then you have to conform to whatever the actual Swim Ontario, the insurance actually is. But outside of that, absolutely, it could apply to an open water scenario. Like there's nothing specific about our recommendations that are applied to only pool-based training. And so these recommendations, as long as you're following the municipal or the provincial guidelines that are in place around group and gathering sizes, then the location of where that occurs doesn't necessarily matter. The only thing to be aware of, and this is one of the ones that it's very, very an odd conversation to have, because there's so little information, and due to the lack of information, and this is not just in Canada, internationally, there's a lot of assumptions being made around open water training. And so their medical community is confident that this virus cannot survive in a chlorinated environment. The rationale behind other water-based scenarios, say in an ocean or in a lake, is more of a volume of water. They're not saying that the virus can't live in that water. What they're saying is that if the virus does enter the water, the amount of water that's actually there, it's going to diffuse and disperse so quickly in the volume of fluid that it would largely be unlikely someone could contract it that way. However, there's not a lot of there's no medical or scientific evidence at this point to say one way or another. And so the assumption is being that training in open water is deemed safe due to the volume of water that you're training in. Not necessarily the same as training in a pool, which is the actual content, the chemical content of that water actually makes that water safe.
Yeah, and we had worked on through the working group regarding the sort of the individual safety mechanism for open water swimming. We're working towards the training one, and it has to work within our insurance boundaries. And it comes back to, again, this whole topic is around about a safe return, safe and responsible activities. And so, next question. Oh, anybody, if you had this one, using widths rather than lengths, depending, the idea you would be able to fit more people in, but then allow you to follow that.
Yeah, the thing that I'd say here, it's like if one of the things in step one that we're talking about is returning short course. Now, eventually in subsequent steps, and depending on group size and the number of people allowed in facilities, you can, of course, have, if you have, we'll say at TPAS, for example, you can have two 25-meter 10-lane pools in the main competition facility. You can then have the diving pool set up to do something. So you can fit more people in, and they can adhere to the physical distancing of the 2 meters that we want to see happen. The issue then comes around is how many people can come into the building, what is a gathering, what is a group size. So there is absolutely, you could get them going, as a lot of you know, down in the US, they use their 50-meter pools 25 yards widthways and put 25 lanes across the pool every 2 meters for the 50 meters. But it can be done, but we then have to say, how does that fit with the current recommendations of how many people are allowed in the building?
Yeah, and the appropriate equipment that goes along with that, because not a lot of our pools are equipped to manage width swimming as we might know it. So, okay.
Well, Dean, to that point, like working with Hillary Caldwell for so long and training in the States quite often at different training camps where we were often training in yards pools where the flags are set up yards. I have lots of experience of rigging up backstroke flags for a 5-meter marking. So it's possible.
No, I'm not saying it's not possible, but
it might
if
be
you have a plan.
Creative solutions to do that for sure.
Yeah. All right. What is the scientific reason for not being able to use deck space for limited dry land where athletes can be 3 to 5 meters apart? I think we've sort of touched on it, but I think one more go around on this would be great.
Absolutely. So again, this comes down to both. There's 3 factors within that. Is one, the overarching maximum number of people that can be included into a facility. Number 2, it's the burden around sanitation and contact surfaces. It's been interesting debates and arguments with different facility operators that consider the feet the same as the hands. Right now, whenever you go into any store or anything like that, obviously they sanitize anything you've touched with your hands. If you're in a grocery store, they tell you don't search for the perfect apple, pick up an apple, put it in your bag, because it's the hand contact points. And I actually had a number of facility operators equate the feet to the hands, which is not necessarily a transmission point for this virus. However, if you putting anything on the ground or doing any exercising where potentially it's quite easy for the hands to come in contact with the ground, that puts a lot of burden on the facility in order to maintain the appropriate sanitizing after that happens. And then it gets to the point I was talking about earlier, is that the more people you have, whether it's in a pool and on a pool deck, regardless of, again, square footage, the more people that are required to move around a confined space, the greater the likelihood is that you encroach on this mandated requirement to maintain physical distancing. And until those guidelines change, this is something that is going to be in place. And again, it'll change with public health guidelines changing. But currently, under the restrictions that are currently in place, this is a way to mitigate and lower risk and guarantee that we're being able to adhere to all of those requirements that are in place.
Okay. Next question. All right. Does a coach need to wear a mask to be on deck during phase 1 and 2?
So again, this is a super interesting one, and it's been really interesting to see the federal response on this in terms of the guidelines around masks. Because of who I end up getting to work with and talk to on a regular basis, a lot of physicians that work in public health that we deal with from day one were saying wear a mask. And they weren't saying wear a mask because it limits the transmission or potential contact with the virus. As soon as you put a mask on your face, you're just more aware around you. You're not going to touch your eyes, your mouth as much, your ears as much. You're not going to do the physical contact. And it's a constant reminder to keep your distance from people. And then people see you with the mask, and that's a constant reminder to them to keep their distance from you as well. So we don't recommend necessarily requiring coaches or staff or athletes to wear masks. Many of the facilities that we've talked to have said, hey, just so you know, when we do open, all coaches will have to wear a mask. So facilities may put that requirement. It's just good advice. I think that at this point, the general consensus across the medical community and information that's coming out from the federal government is that if you can't guarantee social distancing, wear a mask. But even then, just wearing a mask is just sound advice. And does it provide you with more or less protection, or does it change your social behavior? If it changes your social behavior, then that's the protection it's affording you. So it's not a bad idea, but not necessarily a requirement from our perspective, but absolutely maybe a requirement for the given facility that you work in. And it's just not a bad thing to do.
Okay, next question. Okay, will clubs submit their reopening plans to Swim Ontario as part of the affiliation process? We're not 100% at that point. And here's a little bit of the background to this, is that across the country, everybody has their own different ways of doing it. Most provinces, most of their governing bodies, ministries, have asked for a return to sport plan from the provincial bodies. Here in Ontario, they haven't asked that. We've asked several times, do you want to see that? So part of that is that we went through a process with our members. We've had webinars, we've had surveys. We've tried to be as inclusive as possible to what we know to try and create a return to sport, a return to play process guidelines. That's hence we put something out on Thursday, sort of to be a bit of a preparation for the Swimming Canada framework. And knowing that things aren't going to open up right away. Obviously, people are in different stages of their planning. And we need a bit of time to figure out what is going to be the best piece, to figure out what is the ways to actually help the clubs or help organizations or help the facilities, help the municipalities to understand. I think the framework that's been delivered since Friday is a helpful tool in that. That will help give us credibility. It will help give us context that we can help work with all the clubs and coaches. And we know that each facility is going to be different. We know that already when you start talking about the facilities that we are partnered with when it comes to our provincial programming. And so it's in the works, but I can't say 100% that's how we're going to do it. There are certain things that we're going to look at. Obviously, open water safety measures, we're going to ask for some clarity and some semblance of responsibility to that, but nothing yet 100%. We're working on things daily. It's just one thing at a time right now. Okay, next question. Let's see. Oh, this is about, pushing, from our webinars. I'll just speak to it, and then, maybe you two can weigh in on this. From our original webinars and our surveys and trying to get a feel with the coaches and the clubs in the province to get an idea, have you had conversations with your municipality or your health authority or even your facilities? What has been talked about? And try and create that there has been dialogue. And we know that certain clubs are not functioning right now. Some are in between, some are on top of their game trying to really push the envelope. My only concern is that we want to make sure it's proper information. It is consistent information because they will sometimes look towards either the provincial or national body and even forgo what the club has done. I think creating a dialogue is really important, create an understanding between both parties so that if needed, we can help. We can definitely help. I think part of what we can do is we can work to a process of influencing as best we can. As you've mentioned before, CSIO, Debbie Lowe, she's had the ear of the minister. She's had the ear of the premier. And some of the amendments that have taken place is because of that direct contact. But there's only so much can be done because it's so complex. It's so huge. And what we have to do is just be at the table each and every time that we're asked to be at the table.
I think the one piece I would add to that, Dean, is I think it's also, I can't really speak to the politics of it, but I can say that at this point, the limitation in the process hasn't necessarily been they don't understand the difference between recreation and competitive swimming. I don't think that's limitation. I think the limitation is the actual capacity of having public health inspectors be able to go in and do approval of facilities. And that's not just in Ontario, that is across the country. Again, I live on an island with no cases for almost a month, and the facilities still can't open because of public health guidelines. And I actually know someone that works for Island Health, Vancouver Island Health, and their mandate right now is he can actually only do inspections one day every 7 days, so that they're limiting how much their staff are actually out and exposed in the environment. So he has to do inspections for restaurants, pool facilities, water systems, fisheries, you name it. And he's cut down to only 1/5 the amount of time available. And most of the time is spent around essential services and the COVID actual testing within that organization. It's just the limiting factor at this point is actual HR capacity.
Good. All right. Can a club wait till on phase 2, or must start with 5 and build? with 5 swimmers and build. Instead of firm numbers, can it be even by family bubbles? And you've talked about bubbles, John, but Allan?
Yeah,
Thoughts
I
on
think
this?
that the family aspect is an interesting one because most provincial health guidelines limit gathering sizes, but obviously excluding the fact that if you're living in a household, that's really considered one person. Or if you have more than 6 people in that household, you can't limit how they would get together. So it's definitely an interesting consideration how you can use family members that are permitted to be within a 2-meter radius of each other. So potentially in a single lane or something like that. I think that's definitely something to consider, keep thinking about, and how would that actually work within a given total group size you're allowed to have. But the one thing I have to say about phase 2, and this has been some common feedback we've had again from across the country, is, you know, my facility is not opening till September. They've already said that. I live in a small town. So we're not going to worry about it right now. We'll just come back in September. I think not to be pessimistic or fear-mongering, I think it's important that everybody does take a minute to sit back and say, what's going to be different in 3 weeks, 4 weeks, or 4 months? If there's no cure, no treatment of a virus that's in our communities, and none of those things are on the way. They're on the way, but they're potentially 6 months, 8 months, a year away. So what ends up going to have to change is either public health officials, like they've kind of started doing in Quebec and like they have done in the States, are just going to accept the human cost of allowing more things to happen and reducing restrictions. Because at this point, there's not another option. There's not a way to get the virus out of our communities other than not allowing people to contact with each other, because that's how it spreads. So I think it is important to look at phase 2 definitely provides more opportunities. And phase 2 is with the assumption that public health officials reduce restrictions further to allow more options for how facilities can operate. We're recommending a minimum 3-week time period between different phases to allow for an evaluation of the processes you have in place. But that doesn't mean they're going to advance in 3-week time periods. Again, like I think even on Ontario, I think it was 3 or 4 weeks ago, they said they're going to reduce all the restrictions. And now every week they just keep kicking it further down the road because they're not getting ahead of the spread of the virus. It's still staying at the same level of spread and the same number of new cases that are occurring. So it's really hard to say when is this stuff going to change. And I think people are starting to look at the fact that I can wait till phase 2, I can wait till phase 3, or let's just wait till September, is really starting to evaluate what's going to be different in September. And it's just again, not trying to be too negative about this. It's just the reality of where we're at with our understanding and control of this virus.
Okay. Here's a question that's come in through the chat. Have you been in touch with the international partners who have already started some of the training to gauge what is happening there?
I've done quite a lot of that. I have a couple of friends in Australia that run the equivalent of a centre like TPAS, the South Australian Aquatic Centre in Marion, which run the Australian Olympic trials last time around. And they're coming back in exactly the same sort of methodic, small group, 1 per lane situation. Different states in Australia got back above others where the prevalence of COVID-19 was significantly lower than, say, New South Wales and Queensland, but they are 1 per lane. They are working out how they can keep physical distancing in place. They're a little bit further ahead because what they've instigated as a facility are lap swimming, come and book your lane. So they'll go online, book a lane. They've got lane 1 from 7 till 8 in the morning. They've got to arrive at a certain time, leave by a certain time. So a little bit further along than we are, but still swimming 1 per lane. The group sizes may be a little bit different and differences from state to state. When you look over in Britain, they're doing things a little bit differently. They're trying to get their equivalent of high performance centres up and running and moving some people around so they can get them in 1 per lane, starting off short course, using both ends of the pool if the group and gathering size would be permitted for them to do that. a lot of the European countries, I've been in contact with Spanish coach Fred Vanu, who's started back maybe 2 weeks ago. And when you think the number and prevalence of deaths that happened in Spain, you'd think they're very conservative, and they are. They're, again, small groups, outdoors, one per lane. Make sure physical distancing is maintained. So there may be different documents that are being produced, but the documents are all designed to work in the environment that they are produced for. And I think that's a very important point for everybody to consider, that, you know, what's happening in the US is completely different from one state to the next. And we've got to work within our own provincial health mandates. So we're obviously tracking where things are at. Club swimming in Britain is not back yet. They're announcing from Swim England, something will come out, I think, 15th of June, and they're looking back at July now. And if everything progresses, that's where they'll go with it. Ireland are not back in yet either. So there's a lot of places in the same position we're in, and obviously we will continue to work and adapt and come out with version 2, 3, or 4 when we need to.
Yeah, and I'll just add to that a little bit too, John, and just to say that, yeah, it's similar on the science and medicine side is using our contacts to get like, okay, what have you guys done? What did you present that allowed that facility to open, and how have you done that? And so that was actually our starting point, because a number of countries were in the water before us. And again, for whatever reason, when we've done the same things or similar, or thought we did a better job, it hasn't led to the same result. So again, it keeps coming back to capacity for whatever reason of our system to progress in this. And it's frustrating. It's frustrating and difficult to do what other people have done and follow their guidelines. Oh, that's not good enough. Okay, let's do this. Well, that doesn't seem to progress anything. So it's, as John has said, we still have to be able to get our system moving forward. And obviously, whatever's worked for other countries around the world it's not applicable to the situation we're in, and it's not swaying hearts and minds of those that end up driving the decisions.
Okay, this comment here is just, will Swim Ontario disseminate the return to swimming framework. I can say that yes, we will do our part to move, influence, educate, assist in our partner. We'll call it municipal and facility partners for sure. Anything to add to that? That was a direction from Swimming Canada, because you can only, as you said, you can only do so much, and then it's the next layer that.
Yeah. And I think also, you kind of have to understand what the federal guidelines are, and where lobbying becomes a lobby group and something that national sporting bodies in Canada are not actually permitted to do under the federal regulations of funding that an NSO receives. But that doesn't mean to say there isn't a lot of contact going on. And I copied Dean into some of that. So to give you an example, when the press statement comes out from Swimming Canada on Friday in an email, and there's a link to the COVID-19 resource hub and a link to the document, that email got sent to a lot of people in a personal email from me. Dear whoever, just thought you might like to see below. There's a link to our COVID-19 website. There's a link on there that will take you to the Swimming Canada Return to Swimming Framework document. Have a look at it. We're ready, we're responsible, and we understand you have to work to the provincial health requirements, but just so that you know, we have a plan here. We're ready to go with this plan. The provinces are aligned with it. Just thought I'd let you know. Thanks very much, and then move on to the next email. So there are many different ways in which you can show that as a sport you can be responsible, and that the provinces are aligned, and that the clubs are aligned as well with both the provincial and the national perspective. And I can say with the people that I'm working with, we're aligned to the National Sport Task Force, which is for all sports, not just swimming. So this alignment from one to the next builds that compelling case to the municipalities and the facility operators. You know what? They really are aligned. They really have done their due diligence in how they've put this together, and can make this a really low risk return to swimming that can lead to the whole sport coming back.
Okay, great. Well, we're getting down to the wire here. I think we've covered off quite a few questions. Obviously, the questions that maybe haven't been covered or addressed, we will follow up. We will either follow up with you or the committee. We will follow up on our own behalf in that regard. John, or Allan, any final words?
I think I just want to say, like, I appreciate the opportunity to be engaged in these conversations, answering these questions. Everyone's looking at this the same way. The sport needs to get back. The business needs to run. You know, like we have to get going, and the rest of the world is getting going ahead of us, and it sucks. And we're working hard. It's hard for all of us, and to try to get this going. I think that appreciate the fact that the different questions we get, the different opinions, are all normal, natural, and that's part of the process. And there's nothing wrong with asking challenging questions or challenging a different way of looking at it. In our perspective, at least my perspective, I can only speak for myself, is, you know, the questions we get, we get input from a number of people in order to come up with answers and provide a rationale or a reason behind where we're coming from. And so the answers we have may not be the answers you want to hear, may not be the answers you like, but they're the ones we have. And it's the same sort of thing. Like, we can't pick what questions come to us, but we will address them as they come, as good as we can, and keep pushing as much as we can to get the doors open again. At this point, that's our biggest struggle, is get into facilities, show this can work, show it can operate. You know, what happens after that, it's so hard to predict and see what the potential is. But at this point, there's an option for nothing. So let's get something and build off of that. Otherwise, we're going to be stuck at nothing for quite some time.
Yeah. Great. John?
Yeah, I'd just reiterate that point from Allan. Have we thought of everything? No. And it's going to take a collective, and the questions that we get make us think about things that we need to cover in version 2 and version 3 and subsequent steps in the process. So, you know, we're going to continue to do that. I thank you for the invitation, Dean. I'm going to have to give my apologies and run to another call that I forgot started at 4. So I want to thank everybody, and I better get on this National Task Force call.
Well, we're just going to wrap. We're going to wrap up. That means I can have the last word, John. So thank you very much. Take care. We'll be in touch.
Bye.
Yeah, just to wrap up here, you know, as I said, we've been working closely with the various levels of sport across the country, working with the sport partners, working with our government people, and trying to get a good handle on it. One, to understand, and then working towards the idea of getting them to understand where we're coming from and what we're going to try and do. We want to get back into the swim business. There's no two ways about it. It's a part of our business platform as well. So make no mistake about this. And the last thing I would just say is that, you know, the return to swimming and sport in today is a privilege that requires the greatest amount of discipline, above and beyond tenets such as patience, prudence, and professionalism. It is critical. So think before you do. It's really important that we get going forward in a manner that makes a lot of sense, the best sense that we can pull together, and then work towards in a manner that's going to help, as been referred to already, foot in the door, faces in the water, because we do feel and we're confident that we have a good plan, a good well thought out plan with so many smart people that have contributed to a plan, that it can have the confidence and the credibility to be successful. But we have to do one step at a time. So Allan, thanks very much. To Brian Eady, who has been listening in, it's a tremendous amount of work that Swimming Canada has done. I've been fortunate to be parts of it, and I just think it's just incredible, the turnarounds, the amount of documentation, the amount of information, and the reach that has been going on is pretty outstanding. And it's hard to understand when we're sitting on the periphery of things, but trust me on this, that we're working on behalf of all of you to get back into the water in a safe, definitely in a safe and a responsible way. That is critical. That can lead to success in due time. So thank you very much, everybody. Thank you, Nicole. Thank you to the Swim Ontario staff for all their work. And thank you to all of you who believe in your program, believe in your swimmers, and doing everything possible that you're capable of doing under such extreme times. Thank you very much. And we'll continue to forge ahead. Thank you.
Thanks, Dean.